Worldwide, non-communicable diseases, or NCDs, kill 38 million people a year. They're fast becoming the most important cause of ill health that both the developed and the developing world have to face. Whether it is the pain caused by cancer or breathlessness caused by end-stage respiratory diseases or heart failure, treating the pain and symptoms and the associated problems caused by NCDs is just as important as treating the diseases themselves. Ms. Cho Cho Win from Myanmar has advanced cervical cancer, which has spread to her bones and is causing paralysis of her lower body. She's a single mother with a 6-year-old son. She needs to have her pain controlled so that she is able to plan for her own care and to provide for the future of her son. Mr. Sain La Aun has cancer of the floor of his mouth, eating into his chin. He not only has pain that makes him want to cry out in the night, but he is unable to work and his family faces financial issues. These patients need palliative care. Palliative care is a medical discipline that uses a holistic approach to care for people facing the problems associated with a life-threatening illness. It includes disease-modifying treatment and symptom control, and addresses the emotional, social, and spiritual issues that patients and their families have to cope with. The world has woken up to the fact that palliative care needs to be developed as part of healthcare services throughout the life course. The World Health Assembly, which is the yearly meeting of the world's health ministers, in 2014 passed a resolution, WHA 6719, which urges all countries to strengthen palliative care service delivery and ensure that it is integrated into the country's healthcare system, from primary care to tertiary care. Ms. Cho Cho Win and Mr. Sain La Aun need oral morphine for their pain, an essential medication which is not easily available in many countries, including Myanmar. They need to be able to obtain strong painkillers even when they return to their home villages. They need to be able to access nursing care and medical advice, as well as support from their communities. This vast sea of human suffering can be addressed and must be addressed. Does your country have a national cancer control program which includes palliative care? Is oral morphine available in your country, in both the hospitals and in the community? See the World Health Organization resource on planning and implementing palliative care services. With better public health measures, deaths from infectious disease are decreasing. As life expectancy increases, people living and dying with NCDs have become a major issue facing governments today, even as they strive to provide universal health coverage. There is now good evidence to show that palliative care produces better health outcomes in terms of quality of life and patient and caregiver satisfaction, with reduction of use of unwanted or ineffective medical interventions and intensive care. Does your country have a national strategy to develop palliative care services for cancer and other NCDs? Every citizen in your country deserves to have access to palliative care, if and when he needs it. Take action today.